Well, hi, this is Jay Arthur, author of Lean Six Sigma for Hospitals and the QIMacros. Now, we've taken you on a tour of the Healthcare Data Guide, and I'd feel badly if I didn't kind of talk about what we might have learned along the way. Most of the charts in this book are P charts. So falls over bed days, C-sections over deliveries, returns to OR over surgeries. These are all things that we could do as a P chart or a U chart. Now, one of the things that I find is that sometimes it's useful to step back a little bit and go, well, we could actually turn all of those into a ratio and then use an XmR chart so that everybody gets the same view of their data. But for the moment, let's just talk about how we might handle this on an ongoing basis in your hospital. In the QIMacros, we have a series of control chart templates. So we have a C, P, NP, and U chart dashboard. Now, if I select that, it'll get you to what you're seeing here, which is a worksheet that has instructions and then a data sheet. And in here you can see by month we put in our falls over bed days, C-sections over deliveries, returns to OR. So all you have to do here is put the numerator, denominator, numerator, denominator, numerator, denominator. Now we can come down here, we have C charts and NP charts and whatever, and click on the P chart template. So what this is going to do is bring up our data about falls. Now we could cycle through and look at the next one. This is C-section rates, whatever. You know, we might want to change the title of this so that it looks a little better. But when you think you've got everything put together, you can click on Create Dashboard. And the Create Dashboard macro will go ahead and create a template for each one of these particular charts and then put it all onto a single sheet. So here you can see we have our dashboard, and here's our falls rate, here's our C-section rate, here's our returns to OR. Now the next month, if we wanted to, we could come in and put in our new data. Let's say it was 10 and 1,001 days. And then we could say refresh charts to add the new data point in here, or we could refresh with stability. And it'll go look through all of our data and do all of our charts and recalculate stability and put it all together for you. All right, so it's going to go through all of our charts here. And then if we come back to our dashboard, you can see we had some out of control points here. This is probably hugging. So that's probably says maybe we're not reporting our data correctly. So it'll actually go out and calculate all of that for you. Now once you're done, you could come back in here and get rid of the templates you don't need, like the C, NP, PU, and run chart. You could delete those. And then we'd have our pure falls and our P charts. And we could just keep adding data to that as we go along. All right, so that's one way to go about that. Now the other thing we could do is we could convert all of this into a ratio and use the XmR dashboard. Now I've already built one of those. And so what I've done here is I've taken our months and falls over bed days and turned that into falls per 1,000 bed days. So there's our formula to convert those two things. C-sections over deliveries, so I turned that into a percentage, and returns to the OR over surgeries is over here. Now we can take that data, drop it into our data sheet here, and again, works the same way as the P chart. We have a data sheet, and you can come right in here and we have an XmR average. We have something that'll do rolling if you want to do like 50 months in a row, a median chart, run charts, but I'm just going to use the average. And again, we could click through here and look at each one individually, or again, we could just click on Create Dashboard, and it will go out and create a dashboard of all of our fall ratios, and then you can keep track of that over time. Now, why do I like the XmR chart over the P chart? Well, I found often that people get sidetracked by the fact they're trying to figure out what the uppy-downy skyline level limits mean, and then they go, well, you tell them, well, it's because the denominator varies, and they go, well, prove it to me, and then you have to get into the data, and we get sidetracked from watching what's going on here in our chart. What I'm interested in is how's our data performing, and you can see this is very similar to our P chart, except that we have a nice stable limit, and so we have things we can track. And then we could add more data in here if we needed to. And so maybe this month it was 8.7 or something. We could come back in and say refresh charts with stability. So once we've added in our new data points, now this time it's not going to notice a hugging because this has slightly different limits. But you get the idea here. We can count on 8 falls per 1,000 bed days, or something on the order of, some 16% C-sections over deliveries. If you wanted to, you can always come back in here and format that axis and tell it that that's actually not a number, that's really a percentage. So we can come in and do that. We could rearrange things as needed to. All right, so those are our ways of creating a dashboard very quickly and easily from all of the different things that you need to track. And I'd encourage you, try it out both ways, P charts and XmR charts of ratios. And I think you'll find the ratio, because we can take a P chart and turn it into a ratio, a U chart, a P prime chart. All of those things can be converted into a XmR chart ratio. And that makes it so that it's all consistent across your organization when you look at it. So your choice. I think this might be the best way to manage your templates, all of your data, in an ongoing way. So we don't have to rerun the chart all the time. Just put it into the dashboard and create that for the future. So that's how you can take all of this data and manage it in an ongoing way. We have hospitals that do 600 metrics across 44 hospitals this way, right? And it takes them a couple hours instead of a couple of weeks to actually do all this stuff. So save yourself some time and learn how to use the dashboards that are in here. And again, you're going to use the CPU or the XmR chart. I'm Jay Arthur. I hope that helps you think about how to take the data in healthcare and put it to good use.